Dr. Ara Deuk here with the Deuk Spine Institute and our segment on YouTube called Spine Scams Exposed. So we're going to be talking about a variety of topics in the world of spine and trying to expose mistruths, misunderstandings, false information, to better help you understand the realities and navigate through the world of spine care and not get caught up in really the quagmire of misinformation. I really believe that if people know the truth, then they're able to make the right decisions for themselves and get better. So today we're going to look at a few topics, but the first one I want to look at is a situation that everyone needs to be aware of. And treatment in spine surgeries can sometimes be very effective and sometimes they don't work. But what patients really want to avoid are treatments that cause injury, particularly permanent injuries to their bodies as a result of the treatment. And so when it comes to treating patients with degenerative spine conditions like herniated disc, bulging disc, ruptured disc, as a spine physician, we want to make sure we're recommending treatments that are safe. The treatments are based on the diagnosis. For example, a pinched spinal cord needs a decompression. You have to go in and unpinch the spinal cord. If you have a fractured vertebrae in your spine, then you need a procedure that's going to stabilize the fracture like a kyphoplasty. A kyphoplasty would be the wrong treatment for spinal cord compression. So you have to make the right diagnosis in order to recommend the right treatment. Now, here's where a lot of doctors fail. They fall short because, number one, they don't know how to make the right diagnosis for a variety of reasons. Number one, they don't even know what the diagnoses are. I'm talking about spine surgeons, therapists, physiatrists, pain management doctors. Literally, they don't know, most of them don't know half the diagnoses. So they're guessing. And one of the ways they guess is by doing shots that really don't work and are kind of shotgun approach treatments to neck pain or back pain. One of these shots is called an epidural steroid injection. And an epidural steroid injection is really an injection of medicine, steroid medicine, into the spine, and it has a specific purpose. It's to reduce the inflammation. Now, why would you want to reduce inflammation? Well, some of the conditions that affect our bodies and our spines involve inflammation. As a matter of fact, the most common condition that affects the spine is a herniated disc with pain. And that pain can be in your neck or your back or your thoracic spine. And if the herniated disc is causing inflammation in your neck, well then you're going to have neck pain. And you can even have headaches as a result of that inflammation, or even arm symptoms like pain going from your neck down your arm. Many people have these conditions and they seek medical attention. If the doctor doesn't make the right diagnosis, they're not going to recommend the right treatment. And if they do the treatment improperly, you could end up with a treatment that doesn't work, or worse, a complication. So let's look at this first case, and it's a patient who, before their treatment, came in to see the pain management doctor. And I'm going to go over this with you. On the left, there's an MRI scan. I'm moving my arrow around. The arrow is pointing to the spinal cord. It's the gray thing. It looks like a gray line, okay? And in front of the spinal cord are vertebrae or bones, and you can clearly see there's lots of bone spurs here in the back of the discs, and they are literally making this whole area narrow, okay, narrow for the spinal cord. Now, what's the right treatment for this? The right treatment for this patient, if they're having pressure on the spinal cord, would be a decompression, to go in surgically and unpinch the nerves in the spinal cord. But this patient instead went to a pain management doctor. And because they went to a pain management doctor, well, they got a pain management treatment, even though they didn't need it and even though it shouldn't have been done. So why should it not be done? Here's why. The treatment they got was an epidural steroid injection. With an epidural steroid injection, we're basically taking the patient's spine and we're bringing a needle in through the back, and we're going between these bones here, and we're trying to put the needle in between the bones and inject medicine in this area. But that's where the spinal cord is. And if you go back and look at this picture here, there's really no room to put a needle in there. And because the pain management doctor didn't recognize that this patient never should have had a needle put in their spine and their neck, they did the needle procedure, and now when you look at what happened afterwards, this patient became paralyzed. Okay? So right after the epidural steroid injection, this pain management doctor put the needle in. It went into the spinal cord, but they didn't know it went into the spinal cord. They injected the steroid. About a cc or a milliliter of material was injected into the spinal cord. That's a big no-no, folks. You don't inject anything into the spinal cord. You don't touch the spinal cord. It's very delicate. You mess with the spinal cord, you go paralyzed. So it is complete malpractice, below the standard of care, to inject someone's spinal cord with epidural medicine. Okay? Why did it happen? Because the doctor did the wrong treatment. There wasn't enough room in the spinal canal to get the needle tip in there and inject medicine around the spinal cord. So instead, they accidentally stuck the needle tip in the spinal cord and then injected medicine, not even realizing their mistake. And this patient is paralyzed as a result. Now, they came and saw me, and they had trouble walking and standing and weakness in their hands as a result of that pain management procedure. Okay? This wasn't a batch of bad steroid. All right, now this pain management doctor would like you to believe it was a batch of bad steroid. It wasn't his fault or her fault for doing it, but it was his fault, and it was a he, and I know who it was, and he's local. And he actually just was greedy and selfish and said, I want to make the money from doing this procedure on the patient. I'm going to stick that needle in there without a care in the world, and instead he paralyzed the patient. So that's why I'm showing you this case, because it is really bad form to paralyze somebody with your treatment, especially when you shouldn't be doing that treatment. This patient needed spine surgery. If you look at this picture here, I'm going to show you the black arrow. You can see the white color inside the gray spinal cord. That white stuff is the medicine he injected, and that is edema inside the spinal cord. And here's the worst thing about it, okay? When you compare that spinal cord to the right side, which is more normal, you can see all the white signal. That is damage that's permanent to the spinal cord. I want you to know something. Most of these pain management doctors, they buy the cheapest, most inexpensive steroid. All right, it's called Deuk. Deuk is not supposed to be used for epidurals. It contains a preservative that's neurotoxic. So if you ever get that needle anywhere near the spinal cord, it kills the nerves. Well, guess what? He injected that neurotoxic substance not near the nerves, but into the most important nerve in your body, your spinal cord. And that's why this case made it to Spine Scams Exposed, because there are a lot of dangerous doctors out there wanting to treat spine conditions and make money off of you, the patient, and your insurance, when they're offering you the wrong treatment and they're not even doing it properly. It puts your life at risk. It puts your health at risk. Go somewhere reputable. Go somewhere you can trust. Go somewhere where the doctors actually put the patient first and aren't there just to make a buck off you, but actually want you to get better the right way. Thank you. I'm Dr. Deuk with Spine Scams Exposed.